Good afternoon. I'm Ilsa Connect. I'm the Director of Policy and Advocacy for the Joyful Heart Foundation. We're pleased to be sharing today the results of our research about victim notification in untested rape kit cases. We hope this webinar will provide you with some tools as you create your victim notification plan in your community. I want to start by telling you a little bit about the Joyful Heart Foundation. Inspired by her role on Law & Order SVU, actress Mariska Hargitay founded Joyful Heart Foundation in 2004 to help survivors heal and reclaim joy in their lives. We are a national organization with hubs in LA, New York, and Honolulu. Our mission is to transform society's response to sexual assault, domestic violence, and child abuse, support survivors' healing, and end this violence forever. We carry out our mission in 3 ways: healing, education, and advocacy. The cornerstone of our advocacy work is our effort to end the rape kit backlog. There are hundreds of thousands of untested rape kits that have never been sent for testing and are languishing in evidence storage rooms across the country. Joyful Heart Foundation supports the testing of each rape kit connected to a reported sexual assault. Swift testing demonstrates a commitment to survivors that we will do everything necessary to help survivors find a path to healing and justice. And it sends a powerful message to survivors that what happened to them matters. The good news is that reform is happening all across the country. Every day it seems that the untested rape kit backlog is in the media. We hear about cases being solved and justice being brought to offenders and, most importantly, to survivors. So far this year, more than 10 states have passed legislation related to rape kit testing. 47 jurisdictions have received funding from the District Attorney's Office of New York and the Bureau of Justice Assistance to test their kits and to work to investigate the cases and engage survivors. And we will see more funding coming out this year. 17 states now have a law addressing the submission of kits. More than 20 states introduced legislation this session. Communities across the country are testing untested kits, some dating back to the 1980s. And as jurisdictions are starting to process these untested kits, questions surface about how to contact survivors in these cases. We want to know, how do we do this in a way that is not harmful? Joyful Heart Foundation recognized the need for research as many of these questions were lingering. So why is it important for us to research this? We know that notifying survivors in these cases, many that are 10, 20, sometimes 30 years old, can surface difficult emotions and can trigger traumatic responses. It was important to recognize that the system failed these survivors once, and we have a responsibility to conduct victim notification in a way that avoids re-traumatizing them. So the when, who, and how of notification have remained largely unanswered as jurisdictions across the country work to develop procedures for victim notification. After our work in Los Angeles and Detroit on the untested kit problem, Joyful Heart Foundation partnered with Dr. Courtney Ahrens with Cal State University at Long Beach to bring criminal justice system professionals, social services, lab and policy professionals, and survivors together to conduct research and to fill the knowledge gap about this process. We sought to answer complex questions about victim notification and to create a guide to help communities engage with survivors in a way that truly honors their experiences and wishes and actually might contribute to their healing. We wanted to create this guide for jurisdictions to develop victim-centered and trauma-informed best practices. I want to just take a minute to express our gratitude to District Attorney Cy Vance of New York and his staff. Joyful Heart is very thankful to him and his staff for recognizing the importance of victim notification research and providing support for this project. He and his staff have been leaders in this work for a very, very long time. So now I want to turn over the reins to Dr. Ahrens to discuss some of the methodology behind the research, some major high-level findings, and I want to personally thank her for her compassion and dedication to this project before I do that. So Dr. Ahrens, it's all for you now.
Thank you, Ilse. So I want to start by emphasizing that this is a relatively large study that had a lot of data, and we really struggled with how much information to convey because we wanted to make these conclusions accessible and easy to use by busy professionals, but we also wanted to make more detailed and nuanced conclusions available to those who wanted. In the end, we decided to publish two separate reports. The first is a 60-page summary report that you may have received from the Joyful Heart Foundation, and the second is a more detailed 160-page report that is available on my website. Today, I'm going to be providing you with some information from the larger report in order to help you understand the bigger picture, and then we're going to focus in on the main conclusions that are highlighted in the report that you received. So let me start with the study design. Our overall goal was to develop a set of best practice recommendations about how to reconnect with survivors whose kits had not originally been tested. The study itself unfolded in 3 phases. In phase 1, we conducted phone interviews with 79 legal, medical, clinical, and advocacy professionals. These professionals were recruited from jurisdictions that were actively engaged in addressing the backlog and from among clinical advocacy and policy professionals with more general expertise about survivors' needs. In phase 2, we sought to bring in the survivor's voice by conducting phone interviews with 19 survivors whose kits had not originally been tested. 10 of these survivors then attended a day-long retreat at Peace Over Violence in Los Angeles, where we engaged in group discussions about their recommendations for backlog notification. These survivors were also recruited from jurisdictions that were actively engaged in addressing the backlog and through the End the Backlog website. In phase 3, we then used qualitative analysis to identify a set of 93 unique recommendations that emerged in our interviews with the professionals and survivors. And these recommendations were about the various ways we can go about reconnecting with survivors whose kits had gone untested. These recommendations were then put into an online survey that was sent back to participants for ratings of how important and how feasible each of those recommendations was. Taken together, we interviewed 98 survivors and professionals. As can be seen in this first figure, this interview sample consisted primarily of criminal justice personnel, advocates, and therapists. The online survey was then sent back to participants to rate each recommendation on importance and feasibility. 68 participants completed the online survey, representing a 64% response rate. As can be seen in the second table, there was a fairly even mix of criminal justice personnel, advocates, policy experts, and survivors who completed the survey. All of our participants came from diverse regions of the country and had diverse experiences with notification. The survivor sample was also fairly diverse. Almost 50% were women of color, and just over half had incomes of less than $35,000 per year. Data analysis then unfolded in several stages. In the first phase, we read through all of the interview transcripts and I identified those 93 unique recommendations about how to notify survivors. We then conceptually sorted those recommendations into 7 main categories, each with more specific subcategories underneath. So as can be seen in the figure here, our first category was when to notify. This included all of the recommendations about whether to notify survivors on a regular, ongoing basis, whether to only notify them under select circumstances, such as if there was a hit or if the case was moving forward, or recommendations to allow survivors to determine the frequency of notification themselves. In the end, our 7 categories included recommendations about when to notify, how to notify, who should conduct the notification, what kind of information should be conveyed during that notification process, how to train personnel to conduct notification, organizational supports that could help support the efforts at that organizational level, so policies, procedures at the jurisdiction or organizational level, and legislative support about legislation or other types of community education efforts that could support notification as well. These categories and subcategories then became our qualitative codes and were used to help categorize participants' statements. In the next phase of analysis, we then extended our analysis beyond simply coding for what was recommended, and we began coding participants' reasons or explanations for their recommendations as well. The overarching framework that guided this process can be seen in this figure. At the center of the figure is all of the specific logistical recommendations about when to conduct notification, who should conduct notification, what notification should occur, and how it should be handled. Recommendations about those larger supports for notification then surround the center. These recommendations include everything that can be done in training or at the organizational and legislative levels to make notification more effective. The outer layer then represents the kinds of concerns that were driving people's recommendations. Here, concerns for survivor well-being, organizational efficacy, and public safety emerged as the most salient reasons behind participant recommendations. In the third phase, we then turned to the survey data to help identify recommendations that received the most support from participants. Here, we used means and scatter plots to identify recommendations that were rated as both highly important and highly feasible. Take the scatter plot for when to notify as an example. If we plot ratings of importance along the x-axis at the bottom, and then plot ratings of feasibility along the y-axis on the left side, then we can identify recommendations that received high ratings, identified as 4 or above on a 5-point scale on both importance and feasibility here in the upper right-hand corner. In this case, only the recommendation to allow survivors to determine when they want to receive information was rated as both highly important and highly feasible. Recommendations with more average ratings on importance and feasibility then appear here in the middle of the graph. This is where the remainder of our recommendations appear. Had there been any recommendations that were consistently rated as neither important nor feasible, they would appear here in the lower left corner. In this case, none of the recommendations were rated as consistently unimportant or infeasible. Now, this doesn't mean that individual participants didn't rate some of these recommendations as low in importance or feasibility. Some people did. The scatter plots only represent means, not individual ratings. So our next step was to look at the frequency of ratings for each specific recommendation. Take when to notify as an example again. As can be seen in these pie charts, ratings for the importance of these recommendations may have averaged out to about a 3 on a 5-point scale. But this is not because people thought these recommendations were only moderately important. It is because the averages are actually masking extremely wide variation in people's ratings. What this means is that just as many people argued for only notifying in cases that are being actively investigated as argued for notifying survivors regardless of whether the case will move forward or not. Furthermore, both sides of the argument tended to be based on concerns for survivor well-being. So here, in this first quote, we have an advocate who is arguing that it is cruel to contact survivors if there's nothing in the kit. And here, in the second quote, we have a police officer who's arguing that it is not fair to leave survivors in limbo. Both participants argue for survivor well-being. They just don't define it the same way. And interestingly, this pattern repeated itself for nearly all of our logistical recommendations. So what leads to such diversity of opinions? We don't really know. What we do know is that the ratings were not related to participants' professions. Take ratings of the recommendation to notify survivors whether the case will move forward or not. As can be seen in this figure, average ratings were fairly similar across participants. In fact, results from a series of multivariate analysis of variance tests revealed no significant differences between groups in any of our major categories. What this means is that police are as likely to disagree with each other as they are to disagree with advocates, and advocates are as likely to disagree with each other as they are to disagree with survivors. This conclusion was also true when examined at the purely qualitative level. As can be seen in this next figure, the number of participants who offered qualitative recommendations about limiting notification, engaging in regular and ongoing notification, and allowing survivors to determine the frequency of notification was proportionally similar across all 4 of our participant groups. And again, this pattern repeated itself for nearly all of our logistical recommendations. But while consensus about many of the specific logistical steps remained elusive, broader recommendations about how to approach the notification process received far more support. So drawing on the highly supported recommendations from our scatter plots, we identified 15 recommendations about specific notification techniques that received broad support from nearly all of our participants. As can be seen in this figure, these recommendations were all much broader in nature, and they tended to emphasize survivor choice and determination, survivor safety and confidentiality, the importance of empathy and emotional support, and the importance of providing information. There was also widespread support for many of our broader recommendations about how to support the notification process. As can be seen in the outer ring of this figure, an additional 19 recommendations about how to train notifiers, how to support notification at the organizational level, and legislative changes that would help support notification also received broad support. So, taken together, these 34 highly supported recommendations point to a set of best practices for re-engaging with survivors whose rape kits were not originally tested. These are the 8 best practices that are included in the report put out by the Joyful Heart Foundation. They include convening a multidisciplinary team consisting of survivors, advocates, and criminal justice personnel. Ensuring survivor determination by providing survivors choices about how, where, and when they wish to receive information. Employing kindness and respect when interacting with survivors, and offering an apology when possible. Protecting survivors' privacy and confidentiality by being aware that not everyone in the survivor's life will know about the assault. Providing information about the case, about the criminal justice system, and about next steps that may occur. Training notifiers to interact effectively with survivors, explain the process, and respond to survivors' needs. Offering support and resources for local service providers. And prioritizing survivor safety, both during and after the notification process. To talk about the practical implications of these findings, I'd now like to turn the webinar over to Ilse Knecht, the Director of Policy and Advocacy at the Joyful Heart Foundation. If you have any questions about the methodological aspects of this study, feel free to text your questions to the facilitator, and I will try to address these questions at the end. Ilse?
Thank you so much, Courtney, for that information. It's so helpful to hear about the methodology. I'm now going to unpack the take-home messages a little bit for you, starting with some of the basic questions that each community will be asking themselves as they work towards survivor notification. And we call these the notification choice points. This is whether and when to notify, who should notify, how to notify survivors, and what information should be included during notification. One of the first questions, and potentially one of the most challenging, is which subset of survivors do we notify, or do we notify all of them? In what cases should we be notifying? It's really the question of, do we notify all survivors, or do we notify only when there is some kind of hit on the DNA database and the case will move forward? Most communities are notifying a subset of survivors, mostly those cases that have a DNA hit and will be moving forward in the criminal justice process. But it's actually something that every community has to work on themselves in terms of deciding what they're most comfortable with. As far as the research goes, participants had varying opinions about this question. As Dr. Ahrens mentioned, all participants thought about survivor well-being when they thought about many of these questions that we asked, but perceived that differently. So some looked at this issue of whether and when to notify through a victim's rights lens and felt that all survivors should be notified. Survivors cited the enormous power that receiving information has on healing and also rebuilding trust in their willingness to engage in the criminal justice process. They tended to support more widespread contact and the right to decide about whether and when to receive more communication about their case. Some argued that regular contact can be intrusive and interrupt healing, and they also cited survivor well-being for that. Overall, each survivor is different, and some will want lots of information and some will not want much at all. So it's important to think about the only way to really meet survivor needs, because they're diverse, is to give survivors the voice in the process. Survivors really must be in charge of the notification process, and to counter that loss of control that survivors feel and have experienced during sexual assault. Many survivors said that the need for information, that the information is theirs and it belongs to them, and that they should have access to full information about their case. They even said they wanted information in cases where there may be no case progress. For example, when the statute of limitations has expired, when the offender is deceased, that they still wanted to know about that. So it's important just to remember that really the only way to know about what survivors want is to ask them. Another key question communities face is, how do we notify survivors? So this is about the method of notification. Participants thought about the method and stressed the importance of ensuring safety and confidentiality, and again, survivor agency. It was very important in these backlogged and neglected cases that survivors are offered control over the decisions, and this is really very important in the context of the criminal justice failure to take these cases seriously and to investigate them. And victims of sexual assault often feel as if they have no choices, that everything has been taken from them. So it was, again, one of those offering control over decisions for survivors was very important. We wanted to make sure that we take into account survivors' current life circumstances and their culture. We want to avoid a negative impact on current relationships or statuses like immigration. And survivors need to feel safe. They often fear retribution from the offender and potentially the offender's circle. And so it's important to do safety planning and to think about survivor safety when we're thinking about the methods of how to notify. Participants' opinions varied. This method. When I first started doing this work, I thought, oh, I'll just ask a group of survivors of, a focus group of folks from all across the country, what's the best way? Is it by telephone? Is it in person? And the truth is, there are pros and cons to all methods. Participants' opinions varied on the method, of course, but many supported a personal approach because it conveys the seriousness of the crime. Again, it shows concern for well-being. Most important, or very importantly, it allows notifiers to assess a survivor's reaction and needs at that moment and to make very timely referrals. And also enables notifiers to give survivors information and answer questions immediately. Some, again, will want to know everything, and some will not, but may come back to you later with a page of 20 questions. Some participants favored more impersonal techniques because survivors could then choose how and when to respond, as opposed to a phone call or coming to the survivor's house in person. Many communities are doing a mix of these two things. What some places are doing is starting with the phone call and then meeting in person, asking the survivor when the next time that might be best for them to meet and where would they like to meet to talk more about the case. And then they're doing things like creating a toll-free number and potentially putting information in the media and also on a website to say that survivors can call to opt in to get information on their case if they want to. Some survivors said these impersonal techniques felt like they were being checked off a list, and that the more personal approach actually made them feel that there was caring behind the notification. So what came down to is that many participants supported sort of a multi-stage approach that starts with an initial alert and builds to a more detailed interaction at a time and place of the survivor's choosing. Survivors felt that the tone was very important, a little bit more important than how it happened. They wanted a slow and patient approach that allows them time to process the information and to make decisions about participating in the criminal justice system. They wanted someone to care and to be nice to them. They voiced that receiving an apology is very important. They wanted the criminal justice system to be responsible and accountable for the mistakes in the past, and they wanted to hear about the way the community is addressing the untested kit backlog and how the backlog is going to be prevented in the future. All of this information is very key to trusting and engaging in the system. So it's less in many ways about the specific method that is used than the tone of the interaction itself. And so it's really important to now look at the who of notification. So who is the best person or persons to notify a survivor? Again, as you might guess, participants had a wide range of opinions about this. around 75% of survivors thought it was very important for victim advocates to be involved in notification because they are active listeners and they're trained in crisis management. They are good at deflecting self-blame. They're likely to respond in a way that is supportive and empathetic. But they also are able to help bridge between law enforcement and the survivor, where there may be some tensions and anger on the part of the survivor about previous interactions with law enforcement. Participants strongly favored the inclusion of community advocates because they are not bound by the criminal justice system and they're able to focus their efforts more on survivor needs and not the criminal justice system goals. So including community-based advocates was something that survivors and participants in general felt very positive about. So one thing that's very important when we're thinking about notifying survivors is to recognize that certain populations, including communities of color, tribal communities, LGBTQ communities and the homeless have historically been mistreated by the criminal justice system and very likely will struggle with a decision to engage in the system. And in particular, of course, in these untested rape kit cases, many survivors report having been treated poorly in the past and felt that they were neglected by the system. So including advocacy groups from these communities to pave the way for survivors to feel comfortable putting trust in the system is very, very crucial. When you're creating a multidisciplinary team to do your notifications, it's a really great idea to include these advocacy groups in not only the planning but in the actual notification to these survivors from these groups. Creating a multidisciplinary team was viewed by survey participants as a very promising approach. Most of the survivors supported the idea of a law enforcement and advocate pairing. In many communities now, they are pairing a law enforcement investigator or professional detective in with a system-based advocate to do the notification, but also bringing in the community advocates to help with more of the long-term needs and support from survivors, or that survivors have. What ended up actually being very interesting, I think, from the findings is that survivors especially reported that the profession of the notifier is not as important, or the gender, by the way, is not as important as the training of the notifier. And the tone of the actual interaction, that the most capable notifiers are going to be able to understand the effect of trauma on survivors and the wide range of ways that survivors might respond to notification. They should be prepared for all kinds of questions and be prepared to apologize, again, and to discuss the untested kit issue, what the response is like now, and to be able to hear survivors' feelings about their kit remaining untested for so long. Notifiers also be trained and made aware of the potential and the impact of vicarious trauma. This is actually very important. It's very important to understand that this can be tough work doing these notifications, and it's really important for teams to be prepared for self-care and to make a plan for self-care. So we also talked about what information should be included during notification. And survivors told us that it's very important to them to get full information about their cases and about the criminal justice system and the rape kit backlog. The information helps them heal and make choices, and that they're more likely to engage and stay engaged with the process when they are informed. Participants varied widely, not surprisingly, in their recommendations about the amount of detail to give survivors, but the notification process is not just about equipping survivors with test results or giving them test results. It's actually about arming them to be able to cope. So survivors stressed that the information really does belong to them and it should be in their hands. There were some participants that favored not giving actually full information just because of privacy concerns and case integrity. But again, the participants, many of the survivors stress again that this is their information and that they have a right, a victim's right to that information. Again, it's all about offering choices. Very important to just remember through all of this work that survivors must be in charge of the notification experience, that they must have full information because it helps them stay engaged and to be engaged and stay engaged because they are then prepared for what might happen. So there's some advanced preparation that could be done, and this was suggested by folks in our research, that communities should create a list of resources available to survivors and information about the criminal justice process, Sometimes we use lingo that survivors don't understand, and that might be helpful to have some kind of definitions sheet or a timeline. They felt that when presented with this information, it showed this advanced preparation showed caring and concerns for well-being, and that notifiers had taken the time to prepare this information for them. So this is in the research report. This is a decision tree, basically we call it, and you can start at the top and work your way down. I think it's something that is helpful for communities to use as you are sitting down and you're creating your victim notification process. Again, it's all those questions that we asked in our research, and you also have to go through and ask yourself in your community. So this is actually in the research report. If you haven't downloaded a copy of that, it is available on our website. And again, back to our best practices and guiding principles. These are our top line, of course, takeaways from this research. And Dr. Ahrens read through these. I'm not going to go back through them completely, but I think it's important to recognize that it's not just advocates' job to make sure that survivors' needs are addressed. That survivors' needs are at the heart of every decision in deciding how to do notification in your community, and that it's something that should be taken on by all members of your team. It's important to remember that survivors are diverse. The only way to be really victim-centered is to give choices to survivors and let them be driving the victim notification process. Providing full information and resources helps them connect and stay engaged. Being kind and gentle and patient, being empathetic and understanding and providing support. We also know that coordinating and collaborating for in the response to survivors in general is a better way for us to make sure that survivors' needs and wishes are met. All of this work and all of these principles and take-home messages and all of these actions will help mend the connection that was broken when the system failed to test these kits. It's important to make sure that your community creates a victim notification policy on paper that spells out how you will treat survivors and conduct notification. I have had communities say, well, can't you just send me something I can use? And the answer is no, I can send you samples. But you really need to get all your team members around a table. They need to look at our research, and they need to understand trauma, and they need to understand what it means to be victim-centered. All team members must be involved in writing this policy, because your team will then buy in and feel that this is their policy and their procedure and what they feel comfortable doing. So we'll generate buy-in and compliance to actually sit down and go through this process of creating a notification plan. So you can go through our research and ask all these questions to your team. Of course, very important to include survivors in designing your notification plan in every step of the way in your untested rape kit reform, whatever that may look like. Very important to have survivors at the table. Again, I want to just underscore the need to take care of yourself and your team and to develop self-care plans. It's very, very important to do that so that we can help others with healing. We have to take care of ourselves first. It's sort of like the airbag in the airplane philosophy. So I want to encourage everyone to visit endthebacklog.org to download the report if you haven't so far, for news, for statistics, legislative updates, information, and inspiration. We're really pleased to share this research with you. We know that so many communities are going through this notification process, and we are here to assist you. So please call us if we can be of any assistance as you do this work and you work to engage survivors in the pursuit of justice. I want to thank you very much for listening to this webinar, and I hope you have a great afternoon.